Welcome back to the Change Physician Podcast. I'm Melissa Cady with my co-host, Dr. Kevin Cuccaro, with our wonderful guest, Dr. Nithya Natrajan. Did I say it correctly?
That's right.
Yay. She is a family medicine physician, also a certified lactation counselor. And I actually came across her on a Kevin MD article and really piqued my interest. And so thank you for, accepting the invite to be part of the podcast.
Of course. Thank you for having me.
Absolutely. Well, we always start from the beginning, and it always starts with why you even chose to go into medicine. So can you just talk about kind of your mindset and what geared you in that direction?
Yeah, of course. So in undergrad, I actually started out as a genetics major and thought I was going to go into research, and went pretty hardcore on doing research my first 2 years. And then I had this experience in Brazil as part of a study abroad. The University of Georgia has a ton of support for study abroad, where I got to work with children and their families that had cancer. And I worked with them in a group home as well as in the hospital and at their school. And it just made me realize that human component was something that was missing from the research that I had been doing. And it was funny because when I sat down with my research mentor and I told her, I think I want to go to medical school, she said, I knew you would, because she felt like that aligned with my goals and my desires to kind of reach out and help people in the community, much more than research where, it might take 30, 40, 50 years for that to have, a meaningful impact. So she kind of knew before I knew. And that's kind of a common thread, I feel like, throughout the last 10 or 15 years of coming to where I am now, is there's these moments that just stick out as, wow, oh my gosh, I can continue kind of doing what I'm doing, but I'm going to do it in a way that's better for my goals and what I can give back to society and to our community.
Definitely. And so when you went through the whole medical school, application process and you got in there, and when you went through medical school, was there anything that you were specifically targeting for a specialty at all?
Yep. So I initially thought I wanted to do pediatrics, and then I got to third year and I kind of fell in love with everything. And I remember I called my dad, he's an REI, and I was like, Dad, I kind of like all of it. And he's like, okay, well, what haven't you done yet? So I told him I haven't done family medicine yet. And he said, all right, well, why don't you see what happens when you do your family medicine rotation? Because if you love taking care of babies and children, but you also love taking care of OB patients and you love taking care of geriatric patients, you can do all of that. You just need to see if it's the right fit. And it was amazing. It was my last rotation of the year, and I got there. And I remember thinking, these are my people. This is where I want to be, where I can really connect all the threads of people's care and be able to support them both medically as well as socially and emotionally, and kind of really be there for them as an entire person. Gotcha. So that's kind of what brought me to family medicine to begin with.
Awesome.
I want to add on to that, because when you were talking about when you were doing genetics research and you talked to your mentor at the time and they said, oh, I knew you're going to go into medicine. When then you chose family medicine, where your classmates or peers were like, oh, of course, this is totally you. And again, could see what you couldn't see, or was that a surprise to them?
I think it was a little bit of a surprise to my mentors, at least. I think my classmates probably knew. And it was funny because I had specifically requested to have a pediatric preceptor during my first 2 years. And I got put in a community family medicine clinic. And I was like, well, what am I going to do there? That's not really where I want to go. But it was the most amazing experience. And I think it just took really going through clinical rotations and seeing what being a physician in different fields looked like for me to realize that was absolutely where I should have been. And I think a lot of my friends could also tell that was where I should have been to begin with.
Yeah. When you actually got into family medicine, so I assume that was just kind of like a smooth transition, went into family medicine. Where was there any shift in your life or your career that made you take a different direction or tailor your career or life in a different way?
So it was interesting because I started residency, and you have all these ideas of what medicine should be and what being a doctor should be, right? And then the reality hits you of this is what working in an insurance-based system looks like. This is what it looks like when you have 10 to 15 minutes with patients. This is what it looks like when you don't even get time to really know who your patients are, right? And I think it took a while for me to understand that was what was bothering me, because by the time we get to third year, we're seeing like 12 to 15 patients a day, a half day, excuse me. And when you're seeing that many patients, you just don't have time to get to know all of them. And I think that a lot of the reason I went into family medicine was so I could know them, so I could understand their social situation, and so I could understand their needs. And you just can't do that in 10 or 15 minutes. Right. And I think there was one encounter that just stood out to me. It was an older patient. She wasn't my patient. They added her onto a schedule where they had already added on, I think, 2 or 3 patients. I had like 16, 17 patients that afternoon. So I didn't see her till 5:30. And I walk in the room and her daughter says, "I just need you to help my mom." And I said, "Okay, well, how can I help her?" And I just remember I was exhausted and frustrated. I'd like already worked a ton of time that week. And she was like, I don't know what's wrong, but somebody needs to help my mom. I just felt so helpless because it was already 5:30. There was this drive to get everything done and go. And what this woman needed, it was probably an hour-long family conference to figure out what was going on, right? But that's not something you can do in fee-for-service or in insurance-based care usually. And interestingly, I ended up doing a geriatrics fellowship because of encounters just like that. Because the job I was supposed to get fell through at the last minute. And I happened to know the geriatric program director, and she told me, I think this would be a good fit for you if you're interested. We have a spot. And so I kind of ended up in geriatrics for a fellowship.
Wow.
So it's interesting because I feel like life has kind of taken me to all these different places for specific reasons, right? Because I'm not really doing geriatrics anymore, but I feel like the basis of geriatrics is getting to know your patients and not just throwing guidelines at them, but saying, this is what makes sense for your care based on your situation. And that's what I'm really trying to do with my business now. And the services I'm providing is to talk to families, to talk to parents and figure out what they need and meet them where they are. And that's why I wanted to do it outside of the traditional system as well. So that was kind of where I was with training. And I know you had asked, was there a moment that kind of was life-changing? So we had gone through a lot of infertility issues during residency. And then I was able to get pregnant in fellowship with some assistance from an REI, and my program director was amazing. And then we had our baby right at the end of fellowship, and I had this massive postpartum hemorrhage in the hospital. And then I went home, and it happened again at home. And it was like the most terrifying experience I've ever had. And thankfully, my dad happened to be there, and he was like, this is not normal. You need to go to the hospital right now. And he knows my OB personally from, professional experience and things like that. So he called his cell phone. He was like, you need to get her in right now. She's like actively bleeding out here. And so I remember going to the hospital, and I think I was not really processing what was happening. So I got there, and they said my hemoglobin was, I think it was under 6 when I got there. My blood pressures were like 70/40. And then the anesthesiologist couldn't find a line. Like he was like, I need to place 2 large bore IVs and I can't find one. And so he started talking about placing an EJ and all kinds of stuff. And I think it just hit me that like, wow, this might be it. I might not get to see my baby again or my family again. And I think because they acted so quickly, things turned out okay. But I think a lot of people don't get that support. A lot of parents don't get that support. And that's kind of what drew me toward working with new families. And then on top of that, we had a ton of breastfeeding issues. And that's kind of where that lactation counseling portion came in.
Wow. So when you kind of give me a little timeline here. So when you finished all your training, how long were you doing after the geriatrics fellowship? How long were you doing traditional, like, family work, I'm assuming, or how did that kind of timeline go?
Yeah. So we had our baby like in June of fellowship. And I think after everything that happened, I hadn't signed a contract with anyone, thankfully. So I ended up working with my dad's practice doing locums, and I worked with his practice for about 2 years doing that. And so I did a lot of, non-IVF infertility management, hormone replacement therapy management for older patients. And again, it was an experience I wasn't expecting, but I got so many great skills and so much great knowledge from that. That's really helping with the breastfeeding practice and with helping patients understand what's going on. And so after our second child was born, which thankfully went fine, I ended up going more non-clinical for a little bit and then realized, I really missed the patient care portion. But I wanted to do it in a way that was meaningful to me, as well as in an area that I just was extremely interested in, which the perinatal period and breastfeeding and just improving maternal outcomes is just such a huge issue in our nation right now. And it just pulled me to it. So the pandemic kind of pushed me into starting it earlier than I was expecting to. But again, it all just kind of lined up, and it was, there's been all these events that I at the time felt like they were catastrophic, or felt like they were, like what was going on with my life. But then in retrospect, those events are what led me to where I am now. And I feel like I'm doing something that is truly meaningful and helpful and will hopefully give back to women and families throughout our community.
Well, meaningful, helpful, and it kind of strikes those chords that have been coming up in your story over and over again. This desire to actually get to know your patients and provide this safe space where you can provide that educational component and support through really, really challenging times. So, really cool, really, really cool. And what I really like about that is, again, this thread coming up over and over again, and we've heard this in many different interviews, is that physicians go into medicine because we want to help people. And oftentimes the system itself is not set up in such a way. And it's sad because in primary care, which you guys have such an important role to play, and the system has shrunk that role because they take away the time in this whole, the widget minded way. So I absolutely applaud what you're doing. And I love it. I mean, I love all the little twists and turns and things.
Yeah. Well, it seems like you've had to, evolve and adapt but yet kind of clinging on to those things that really appeal to you and knowing where people need to be served. So I'm curious how things look now, or what you're building and your services. How does this work, and what exactly are you doing now?
Yeah. So the business that I launched is called Blossoming Mamas, and it's about really providing support in the perinatal period. In the last year, I've set it up in the last year or so, and we just launched at the beginning of this year. And it's a telemedicine service. Right now, we're serving patients throughout South Carolina. And we do a 4th trimester package where we are trying to start people off with a prenatal visit, help them establish breastfeeding and delivery goals, and then supporting them through, that first trimester through an initial postpartum visit to make sure everything is going well. And then we do at least one follow-up, either to help them get back to work, or if they're having problems, then we will help with those problems. And then I also offer text messaging and telephone support, so they can call me on my cell phone or text message me if they're having an issue, and hopefully get help sooner because of that. And then with the telemedicine portion, again, with the pandemic kind of pushing all of this, it just made sense to start it with telemedicine because babies are very vulnerable, new moms are very vulnerable, and it just didn't make sense to make them go out somewhere else or bring somebody strange into their home. And so that's why I decided to start it with the telemedicine and hopefully expand it to be able to have the capacity for in-person visits eventually.
Yeah.
And then I'm also offering some infertility support and assistance to families that may want to adopt or have a surrogate, or are not able to have their own children biologically if they want to breastfeed, or they want help finding out what their resources are for feeding their infant. We'll provide support for that through those services as well.
Wow, that's really great. I think I think telemedicine's been kind of a new world for a lot of people, but it makes a lot of sense. I'm curious, how are you finding your patients? Are there certain people that you're just connecting with other businesses and they're referring to you, or are you marketing online, or how are you doing that? I'm just curious.
Yep. So I've been slowly networking with various providers throughout our region. We're actually having another baby in April, so I haven't been super aggressive about it right now.
Oh, wow.
But I've been talking to other lactation professionals, doulas, OBGYN offices, pediatric offices, just letting them know the services are there, because there's usually a lot of support around what baby needs for breastfeeding, but there's not always a lot of support or knowledge around what mom needs, especially with breastfeeding medicine. There's just, there's data, there's just not many physicians that are aware of it or understand how to manage it. So that I've just been trying to grow it organically and not worrying a lot about volume right now.
Sure.
And then I'm also doing some social media, because the whole point of this to me is to get accurate information to families. And so I've been also doing that more organically, not trying to do paid ads or anything, but more trying to spread it around to both providers and to patients so that they can learn more about breastfeeding and breastfeeding care and medicine.
Great.
Well, that perinatal time period is so stressful, speaking as a parent. I'll never forget, we had our first at the end of internship, and I'm like, I'll never forget this. You take my son, and they're like, okay, you need to go home now. And I'm like, oh crap, I've delivered babies, but what am I supposed to do now? It was the scariest thing, right? You're taking this small little person, this little life with you. And all I could remember thinking is, holy crap, my wife and I are physicians and we're still terrified. I can't even imagine what this is like for somebody else. So the fact that you're being able to provide the service, and I love the fact with the telemedicine makes so much sense for this, because when you're a scared parent and you're a scared mom and you're nervous, it's so nice that to be able to, and you're exhausted, let's not even forget about that part when you have the newborn, that they can reach out to you directly in that way. So I love that. On a not so happy note, what I was looking at your website, and I just want to talk about this a little bit, is I interested you have a consultation on infertility and pregnancy loss, which is an issue I don't think many people talk about or many people are aware of. So could you kind of bring that in a little bit more, and why did you decide to add that? And what have your experiences been around that? Again, not the happiest niche, but an extraordinarily important one, which I think probably not a lot of people are talking about, people aren't aware of until maybe something horrible happens. And then you're like, well, what do I do now?
Right. Well, we know that about 1 in 4 pregnancies results in a pregnancy loss. And even if that loss is early, it can still be very painful, right? Especially if a family has already been dealing with infertility and now they've lost this baby that they've been waiting for. So the whole purpose behind that is we actually lost 3 pregnancies between my 3rd year in residency and the beginning of fellowship. And I just never told anybody about it, right? And I just kind of kept going. And I think that affected everything, right? Because it is a big loss to some people. Some people may not feel as intensely about it. It just depends on how your family is and how you are emotionally with it, and what, your whole process has been to get to that point. And those were all very wanted pregnancies for my husband and I, but they just didn't work out. And, I think that it was just really difficult because I didn't have anybody to talk to about it. I had my one resident friend that I ended up talking to because, there was a lot going on in our program. I was chief resident as well, and we had a lot of transitions and a resident leave the program around the same time all this was happening. And I just remember on inpatient, I told one of the second years, some things don't matter. And my friend was like, we just need to go talk about what's happening. And I will always be so grateful for her. She was also my co-fellow, and she was just such a huge support through all of this. But some people don't have any support, right? And some people don't even have a spouse or anybody else to rely on when this happens. And a lot of times it's ignored, or your job doesn't even know it happens, or if they do, a lot of times they expect you to just kind of bounce back. But to you, you've lost a baby. To them, it's like, okay, that happened, now it's over, especially if it's early, right? If it's before 12 weeks, which is when most of this happens, they may not know you're pregnant, or even if they do, they're like, it was before 12 weeks, especially in medicine, right? Because we know it happens all the time, which my residency did not know about this. They were not aware about it. My fellowship director knew because we were undergoing fertility treatments, which I didn't need IVF, but we still had a lot of doctor's visits and things. But the reason I'm offering the visits is because this is such a common occurrence, and a lot of people just don't have support to get through it. They don't know what their options are. I think a lot of people are pushed toward IVF when potentially other interventions could help them earlier. Technically, I'm not, prescribing or anything like that, but I can at least provide that support component and teach them what I've learned through my own journey. And then again, if they're not able to get pregnant, that doesn't mean you can't be a parent. You can still adopt, you can still have a surrogate. There are other options. And I know, for some moms or some parents, they do want to have that breastfeeding experience still. So that's another portion of our offerings, is I can help with inducing lactation. And that's kind of plus or minus if it'll work, but a lot of it has to do with bonding with the baby, and we can still, at least, even if it's just a little bit of milk, they can still feel like they've given that to their child. So that was where that whole idea was born. It actually, it's interesting because it wasn't a service I was originally offering. And then we were, during Infertility Awareness Month last year, I was just thinking about it, and I was like, there's just not many services for these families, right? We talk about it, but who's really supporting them? Who's there to kind of guide them through this very complicated system? And so that's the whole point, the whole reason that I decided to start adding that service.
Yeah, it's amazing. I mean, it is such amazing because we have some very, very close friends that happened to, and there's a sense, I don't know if it's a sense of shame or hiding. And all I can remember is being such good friends with them. They're at our house, and all of a sudden they just left. They're like, we have to go. And we're like, well, okay. And we didn't really understand what was going on. And it was later they told us that they lost pregnancy at our house. And so it is a very emotional thing. And I'm like, man, if I wish they felt safe enough to talk to us, but it is so complex. Sometimes you need someone who is not so close to you to discuss. Mm-hmm. So as soon as I saw that, I just had to ask you about it, because it is such an important service that, again, not many people are thinking of until, unfortunately, those things occur. So thank you for that.
Yeah. And I'm curious, even if people aren't in South Carolina, are some of these consultations or some of the counseling that you offer, can that be across state lines, more like coaching, or is it have to be in South Carolina? So
I've been kind of dabbling at looking into coaching. Right now, I'm just in South Carolina because what I'm offering is technically a medical service. I am going to add consults in Georgia after maternity leave, because I'm already licensed there, and we have a lot of connections there already from growing up in Georgia. So definitely South Carolina and Georgia. I'm hoping eventually to add the coaching services. I just need to get a better understanding of how to make that happen.
Sure.
The degree makes it more difficult. Someone can throw up a shingle and say they're a coach and then advertise across the United States. But as soon as you're a physician, you actually have knowledge. All of a sudden, we have all this other stuff we need to think about.
Right.
Yeah, it's you got to make it very clear that little. It's hard to ignore the background in your mind of what you've learned as a physician, but it's like, as long as you're not diagnosing and treating per se, like it's such a nebulous overlap that it can be tricky. But I just ask because if I push it out there to people, there might be people in like Texas or whatever that might need your services. So I'll let you know. But if people want to find you or discover some other things you're doing, where would you like to direct them for now?
So they can go to our website, which is www.blossomingmamas.com. And we have links to our Instagram and Facebook page on there as well. And, even if they're not in South Carolina, if they want to come to South Carolina, anywhere in the state, I can see them as long as they're within the borders of the state. And, even if I can't see them, if they're somewhere else, I'm part of several breastfeeding medicine networks. So we, a lot of times we'll ask each other, hey, is somebody practicing in Georgia? Is someone practicing in Florida or California? And we can almost always find somebody that can at least do a virtual visit, hopefully, for the breastfeeding medicine part of it.
Awesome.
Yeah.
Any other questions, Kevin?
No, other than thank you so much, Nithya, for coming on today. I love it. And I love how you've really sort of taken control of your practice and life and designed something that makes a lot of sense for both you as well as providing a valuable service. And again, thank you so much for coming on the show today. Really, really appreciate it. And I'm going to let Melissa take us out because she has this really cool way she does it.
I don't know about that. But, yeah. Well, again, thank you, Nithya, for being our guest on the Changed Physician podcast. And for those of you that don't know about the Changed Physician, just catching this by chance, you can go to thechangedphysician.com and join the community there. Or if you're a physician ally and would like to be part of the community, you can do that as well. But my co-host, Dr. Kevin Cuccaro, is so nice to let me do the takeout here. We will plan on seeing you on the next episode. You all take care.
Take care, folks.